Could you jump into what you saw as really exciting for 2022, starting with cold plasma therapy?
Right. So the first time I heard about cold plasma therapy was from Lex Friedman's father, who was a physicist as well. And he did cold plasma therapy research. And it got me interested in it. I started looking into it and realized that, yeah, this is actually something that's going to be utilized within the next coming decade or two at most. And basically what it is, so people know that plasma is the fourth state of matter. It's very hot, it's ions, and they can create some really bad damage. But cold plasma therapy is where the ions are not in what's called thermal equilibrium. And so it's still ions that can damage. But the thing is, it won't be hot. It'll be just like room temperature, basically, and maybe a little bit more in some instances. And the aspect of this is that you're basically generating reactive species of various kinds, nitrogen reactive species, oxygen reactive species, and so on, that if you have something like a tumor that is malignant, you can target it specifically without hurting the patient and also eliminate the tumor, providing new ways to use therapies for cancer. But the thing is, it can also transition to something like located or local microorganism disease. Like if Lyme disease is specific to somebody in a joint and they need to use cold plasma therapy, they can use that. And while they'll get some degradation of the joint tissue, it'll heal itself without the bacteria being present.
Yeah, really exciting stuff, because I've known about plasma therapy, full spectrum light therapy, and it basically is quite hot. You can't be near it at some points. And it's pretty interesting because, again, to me, it mimics what the sun is doing, right? The sun is just a ball of plasma that gives us all frequencies and could be healing and also could be somewhat detrimental. But if we're able to isolate that, make that cold and apply it to the body, they're seeing great results on this. And do you think this is going to be something that we're going to see more and more of in 2022? Or you just excited the research coming out?
The research coming out, whether it's going to be available for clinicians and hospitals and other healthcare providers and practitioners, I'm not sure yet. But I do know that since laser therapy is available and they use cold laser therapy, I don't see it being more than a decade before people have their hands on this.
Yeah. And that's going to be something that's going to probably transform a lot of people and how we look at therapy. Now,